Did you know that many men, over 60, experience changes in their penis, but almost no one talks about it? Maybe things don't look or feel the same as they used to. Maybe there's a little discomfort, or you're noticing changes in how things work down there. The truth is, this is extremely common, and it doesn't mean something is wrong, but it does mean it's time to pay attention. Hi, I'm Dr. John, and I've spent over 30 years helping older adults across the United States take better care of their health, especially in areas we're often too embarrassed to talk about. One of the most overlooked topics, intimate health in men over 60. This video is for you or someone you care about. Today, I'm going to walk you through 5 essential things every man should do to care for his penis as he ages. These tips aren't complicated, and they don't require fancy supplements or expensive treatments. They're simple, science-backed, and will help you stay healthy, comfortable, and confident. And here's the best part. By the end of this video, you'll not only know what to do, you'll also understand why it matters so much for your overall well-being. If you find this kind of honest, practical advice helpful, feel free to subscribe. I post weekly videos on senior health with real guidance you can actually use in your everyday life. All right, let's dive in. Let's start with something basic, but often misunderstood: cleanliness. Now you might think, of course I'm clean, Dr. John. I shower every day, and I believe you. But here's the thing. As we age, the skin around the penis becomes thinner, more sensitive, and more prone to irritation. That means the same soap or scrubbing you used when you were 40 might be doing more harm than good today. I had a patient, Bob, 72 years old, retired school teacher, who came in with red, irritated skin. He told me he'd started scrubbing more aggressively because he thought he wasn't cleaning thoroughly enough. But in reality, his skin was reacting to harsh soaps and too much friction. For most men, especially over 60 less, is more when it comes to hygiene down there. Here's what I recommend. Use warm water and a gentle fragrance-free cleanser, like one made for sensitive skin. You don't need antibacterial soaps or anything fancy, just something simple and non-irritating. Avoid using a washcloth or sponge directly on the area your hand is gentle enough. Be sure to dry thoroughly, especially around the folds. Trapped moisture can lead to fungal or bacterial infections, which are more common in older adults due to decreased skin elasticity and immune response. And if you're uncircumcised, meaning you still have your foreskin, it's important to gently pull it back and rinse underneath with warm water. You don't need soap there either, just water, gentle movement, and a good rinse. Also, skip the talcum powder or sprays. I know many men were taught to freshen up with powders, but those can clog pores, irritate the skin, and in some cases, increase long-term health risks. Another thing to watch for is itching or persistent dryness. Many men assume it's just part of aging, but it could be a reaction to soap detergent or even medications. If something feels off, burning, itching, flaking, talk to your doctor. You deserve to be comfortable. Now, I know this might feel like a lot of detail, but let me be clear. Keeping your penis clean doesn't have to be a daily science project. It's just about being gentle, consistent, and paying attention. And here's a little mindset shift. This isn't just about hygiene. It's about self-respect. Taking care of your intimate health is no different than brushing your teeth or trimming your nails. It's part of a full, healthy routine. So give yourself a quick check the next time you shower. Are you being too rough, using a soap that stings or dries you out? Skipping the drying step. Small changes make a big difference. Now we've covered the outside, but what's happening on the inside is just as important. Your circulation, your blood flow, is the engine behind everything from sensation to function. Let's talk about that next, because without good blood flow, even the cleanest equipment won't work properly. Now let's talk about something that doesn't get nearly enough attention: blood flow. Most men think about blood flow only in the context of erections. And yes, it plays a major role there, but it's much bigger than that. Proper circulation keeps the entire area healthy. Without it, tissue can weaken, nerves can become less responsive, and even healing from small cuts or infections can slow down dramatically. Think of blood flow like oil in a car engine. When it's moving freely, everything runs smoothly. But when it's restricted or sluggish, you start having problems, noises, breakdowns, and wear and tear in places you didn't expect. As we age, our arteries naturally stiffen a bit. It's just biology. Combine that with less physical activity, maybe some medications for blood pressure or cholesterol, and suddenly, blood isn't circulating like it used to. And guess what? The penis is one of the first places to notice the change. Here's the good news: you don't need to become a marathon runner to improve your blood flow. In fact, just 20 minutes of walking a day can make a huge difference. I always tell my patients, if you can walk around the block or even around your home during a phone call, that's a great start. Stretching also helps, especially stretches that open up the hips and legs. Why? Because blood has to travel from your heart down into your pelvis and into the penis. If your hip flexors are tight or your legs are inactive, it's like putting a kink in a garden hose. Hydration matters too. Dehydrated blood is thicker blood, which moves slower. Aim for light yellow urine as a simple indicator. If it's too dark, you're probably not drinking enough. Now let me tell you about Marcus, a 67-year-old former delivery driver. He came in worried about decreased sensitivity and a weaker erection. He assumed it was just age. But after talking, we discovered that ever since retiring, he'd been spending most of his day sitting watching TV, reading, or on the computer. No walking, no stretching, and barely drinking water. Within a few weeks of light walking, adding 2 glasses of water in the morning, and doing a few standing stretches during commercials, things improved a lot. Another tip: avoid sitting for too long without movement. Long periods of sitting, especially on hard chairs or in the same position, can reduce circulation to the pelvic area. Set a timer if you need to. Just standing and stretching every 30 to 45 minutes helps. And yes, you can talk to your doctor about circulation-enhancing medications if needed. But for many men, lifestyle changes come first. Their safer cost nothing and improve more than just your intimate health. They help your brain, your heart, your joints, everything. So to sum up this part, support your blood flow like it supports you. Keep your body moving, stretch gently, stay hydrated, and don't underestimate how powerful even small efforts can be when done consistently. Because here's the truth, many problems men face with their penis, like changes in sensitivity, performance, or recovery time, aren't just about age. They're about blood flow. Now that we've covered circulation, let's go one step further and talk about something that too many men ignore, even though it could be the difference between catching a small issue early or facing a much bigger problem later. Let's take a look at the 3 symptoms you should never ignore. Now, this part might be the most important of all, recognizing when something's not quite right and doing something about it. You know your body better than anyone. You live in it every day. And when it starts sending you signals, especially below the belt, it's not trying to scare you. It's asking you to pay attention. There are 3 symptoms in particular that I want every man over 60 to know about. Because when these show up, they could be early signs of something that needs medical attention, and catching things early. That's how we avoid big problems down the road. Symptom number 1, pain or burning during urination. This might seem obvious, but you'd be surprised how many men ignore it. They think, maybe I drank too much coffee or it'll go away. But pain, burning, or a sudden urge to go, especially if it's new, could mean a urinary tract infection, prostatitis, or even early signs of an enlarged prostate. All of these are treatable, especially when caught early. But left alone, they can lead to infections, kidney problems, or even long-term damage. Symptom number 2, any new lumps, swelling, or curvature. This is especially important during self-checks. Once a month, just like we check our skin or teeth, do a quick exam of your genitals. Gently feel for any unusual firmness, swelling, or pain in the penis or testicles. If you notice a curve or bend developing in your erection, especially if it's painful, it could be Peyronie's disease. Not dangerous in most cases, but definitely something a urologist should take a look at. And here's the big one. Symptom number 3, leakage, dribbling, or trouble starting or stopping your stream. This often gets brushed off as just getting older. But here's the thing, it's not always that simple. Frequent urination, especially at night, hesitancy, when starting to pee or leaking after you think you're done. These can all be signs of prostate enlargement, weakened pelvic muscles, or even early neurological changes. Let me tell you about Larry, a 70-year-old veteran who told me he'd been leaking a little during his morning walks. He didn't want to say anything because, in his words, it's just part of aging, right? But when we checked it out, we found he had an enlarged prostate that was putting pressure on his bladder. With a few changes, including pelvic floor exercises and adjusting one of his medications, the leaking stopped. No surgery, no embarrassment, just results. The bigger point here is this: there's no shame in noticing something and asking about it. What's actually risky is ignoring your body's warning signs. So, if something feels different, if your stream is weaker, your sensations change, or you notice discomfort, talk to your primary care doctor or a urologist. You don't have to suffer in silence, and you definitely don't have to guess. In fact, early diagnosis often means simple treatment. Many issues that start as minor annoyances like a slow stream or occasional burning can become much more serious if you let them go. And gentlemen, if you're someone who avoids going to the doctor, unless something is really bad, I get it. But think of it this way. Would you rather fix a leaky faucet now or wait until your entire bathroom floods? Health works the same way. So to wrap up this section, listen to your body. Trust your instincts. If something doesn't feel right, it's okay and wise to ask about it. Next, let's take a look at something a little more sneaky. Something that affects almost every senior man I see, but doesn't get nearly enough attention: how dehydration and even the medications you take could be quietly causing problems. Now, here's something most men never suspect, but it could be quietly affecting your penis health every single day: dehydration and medication side effects. Let's start with dehydration. You might be thinking, Dr. John, I drink coffee in the morning and maybe some iced tea at lunch. I'm fine. But here's the thing, caffeine is a diuretic, which means it pulls water out of your system. And as we age, our sense of thirst becomes less reliable. By the time you feel thirsty, you're probably already mildly dehydrated. Why does this matter for your penis? Because hydration affects everything from blood flow to skin elasticity to nerve function. When your body is running low on fluids, your blood becomes thicker and circulates less efficiently. That can lead to less sensitivity, weaker erections, and slower healing if you get even a small nick from shaving or friction. I once treated a man named George, 74, still sharp as a tack. He came in complaining of feeling numb down there. No pain, just a noticeable lack of feeling. After ruling out the big causes, we realized he was only drinking 1 glass of water a day. The rest of his fluids came from coffee and soda. After increasing his water intake to 6 glasses a day, things started to improve in just 2 weeks. It was that simple. Here's a quick check look at the color of your urine. If it's dark yellow or amber, you're likely dehydrated. Aim for a light yellow lemonade-like color. That's your body saying, thanks, we're good. Now let's talk about medications. If you're over 60, chances are you're on at least 1 prescription, maybe a blood pressure pill, a statin, or something for diabetes or mood. And while these medications are often essential, they can also come with side effects that directly affect your penis. Here are some of the most common culprits. Blood pressure medications, especially beta blockers and certain diuretics, can reduce blood flow to the penis. That can lead to weaker erections or changes in sensation. Antidepressants, especially SSRIs, are known to reduce libido and delay or dull sexual response. Statins, while great for heart health, can sometimes lead to fatigue or reduce testosterone in certain men. Now, let me be clear, I'm not telling you to stop your medications. Never do that without talking to your doctor. But if you've noticed changes in how things feel or function, and you've started a new med, recently bring it up. Your doctor can help you weigh the pros and cons or adjust your dose or timing. In some cases, switching from one blood pressure med to another can completely reverse side effects. It's just about having that conversation and not feeling embarrassed to bring it up. There's also the issue of drug interactions. Sometimes it's not one pill, it's how 2 or 3 of them mix together. They might not cause problems on their own, but when combined, they can affect nerve response, hydration, or hormone levels. And speaking of hormones, we'll get to testosterone in the next section, because yes, that matters too. So here's your simple action plan. Drink more water. A glass first thing in the morning, 1 with each meal and 1 mid-afternoon, is a great place to start. Review your medications. Make a list and ask your pharmacist or doctor if any could affect circulation, libido, or nerve function. Pay attention to how you feel. If you notice changes after starting a new medication, bring it up. It's not complaining, it's advocating for your health. This isn't about giving up what works. It's about finding the balance that supports your whole body, including the parts we don't talk about enough. All right, now that we've covered hydration and meds, let's move on to something many men whisper about, but rarely get answers to: testosterone. How much does it matter after 60? And what should you actually do if it's low? Let's talk about testosterone, the word that makes some men nervous and others curious. Here's what I want you to know right off the bat. Yes, testosterone naturally decreases as you age. That's normal. But lower testosterone doesn't automatically mean you're broken or that something is wrong with you. The goal isn't to chase your 25-year-old levels, it's to understand what's going on and how to support your body through it. Starting around age 30, testosterone levels begin to drop about 1% per year, so by the time you're 60, 70, or 80, that adds up. But here's the key: some decline is expected, but a steep drop that affects your quality of life, that's worth looking into. What kind of symptoms are we talking about? Decreased interest in sex, less frequent or weaker erections, feeling more tired even after rest, loss of muscle mass or strength, mood changes, feeling more irritable or down. Now, I want to introduce you to Sam. Sam was 69 when he came to see me. Former trucker, sharp wit, tough guy, but he told me, "Doc, I feel like I'm fading. I'm not depressed, but I'm just off." After a full checkup, we found his testosterone was below normal for his age, and more importantly, his symptoms matched. We didn't jump straight to testosterone therapy. We started by improving his sleep, cutting back on alcohol, and increasing physical activity. His energy and mood improved within 2 months before we even touched any prescriptions. See, testosterone isn't just about libido. It supports everything from muscle tone to mood to mental clarity. But it also doesn't work alone. It's connected to your sleep, your diet, your activity level, even your stress. Let's talk briefly about what you can do if you're concerned about your testosterone. Get tested, don't guess. A simple blood test in the morning when levels are highest can give you a baseline. But don't let anyone sell you on a low T diagnosis just because you're older. Look at symptoms, not just numbers. Focus on lifestyle first. The best testosterone booster is still lifting light weights, getting good sleep, and eating protein-rich foods like eggs, lean meats, nuts, and beans. Also, cut back on sugar. High sugar intake lowers testosterone, same with excess alcohol. Consider therapy only if needed. Testosterone replacement therapy, TRT, isn't for everyone, and it comes with risks. It can affect prostate health, blood pressure, and fertility. But in the right case and with close monitoring, it can be life-changing. That's a decision to make with a doctor who knows your full health picture. And let me say this loud and clear: aging doesn't mean giving up your vitality. Testosterone might decline, but your sense of purpose, your relationships, your energy, they don't have to. You're not trying to be 25 again. You're trying to feel strong, focused, and yourself. If something feels off, it's okay to ask questions. You deserve honest answers, not shame, and certainly not silence. All right, now, before we wrap up, I want to leave you with something practical. A simple, powerful routine you can do in just a few minutes a day to improve penile health support, bladder control, and even boost confidence. It's called pelvic floor training, and yes, it works for men too. Let's get into it. All right, gentlemen, let me ask you something. When was the last time you thought about the muscles between your hips? Not your abs, not your thighs. I'm talking about the pelvic floor. These are the deep muscles that support your bladder, bowel, and yes, your penis. And just like any other muscle, they can weaken with age unless you train them. Now here's the kicker: pelvic floor exercises, also called Kegels, are not just for women. In fact, they might be one of the most powerful tools senior men have for improving urinary control, sexual performance, and even prostate recovery after surgery. Let me tell you about Frank, a retired high school coach. He was 72, recently had prostate surgery, and was frustrated. He told me, "Doc, I can't walk down the driveway without leaking." He thought this was just his new normal, but after teaching him a few simple pelvic floor exercises and getting him on a daily routine, he regained full control in a matter of weeks. Not months, weeks. So let's break this down simply. What are pelvic floor muscles? Imagine you're trying to stop yourself from passing gas. That squeezing motion, that's your pelvic floor in action. Now imagine you're also trying to stop the flow of urine midstream. Not something I recommend doing regularly, but that's the motion. Those deep internal muscles form a hammock under your bladder and support your urethra. When strong, they help prevent dribbling and leaking, improve erectile firmness and duration, enhance sensation and control during intimacy. How to do a basic pelvic floor Kegel exercise. Sit or lie down in a comfortable position. Tighten the muscles you'd use to stop urinating. Hold that contraction for about 3 to 5 seconds. Don't hold your breath or tighten your stomach or thighs, just those deep muscles. Release and rest for a few seconds. Repeat 10 times in a row, 2-3 times a day. You can work up to holding for 10 seconds, but start small. You can do these exercises while watching TV, lying in bed, even while brushing your teeth. No one can tell you're doing them. Now, here's a quick checklist of what not to do. Don't squeeze your buttocks or legs. That means you're using the wrong muscles. Don't hold your breath. Breathing naturally helps your core stay relaxed. Don't do them while urinating. That should only be used once in a while to find the right muscles. You might start noticing results in 4 to 6 weeks, sometimes even sooner. More control, less leakage, and better support during intimacy. And best of all, no pills, no equipment, just your own body. Let me emphasize, these exercises are especially helpful after prostate procedures or if you're dealing with mild incontinence. But they're also useful before issues start as prevention. Think of it like brushing your teeth, but for your bladder and penis. And one last note, if you're having trouble figuring out which muscles to use or you're not sure you're doing them right, ask your doctor about pelvic floor physical therapy. There are specialists trained to help men strengthen these muscles safely and effectively. It's not awkward, it's smart. All right, you've made it through a lot of information today, and hopefully you're feeling more confident, more informed, and more empowered about your health. But before we wrap up, let's bring it all together. There you have it, my friend, 5 essential ways to care for your penis as you age with confidence and clarity. If this helped you feel more informed and in control, comment 1 below, and don't forget to share this with a buddy who could use some real talk and real solutions. Remember, aging is natural, but suffering in silence is not. You deserve to feel good, stay strong, and live fully. I'm Dr. John, and I'll see you in the next one. Take care of yourself because you're worth it.